Let's talk about summary of incisions. Before watching this video, check my first video on abdominal incisions. There are two types of incisions: vertical and transverse. Midline incisions, name itself indicate, cut in midline. Use for abdominal access, good exposure, minimal damage to tissue but have risk of wound dehiscence. Paramedian side of midline. When midline is not feasible, we do paramedian cut, has less risk of hernia but have limited exposure in some regions. Coker incision. Use in gallbladder, liver surgeries, excellent right upper quadrant exposure but can affect diaphragm function. Subcostal incision. Use in renal or flank surgeries, good exposure, lower risk of hernia but may affect ribs and lower chest muscles. McBurney incision. Use in appendectomy, minimal exposure for appendectomy and limited to specific surgeries. Phalansteal incision. Use in C-sections, gynecological surgeries, cosmetic, less risk of hernia but limited upper abdominal access. Maillard incision. Use in pelvic surgeries, excellent pelvic access and more invasive than phalansteal. Thoracoabdominal incision. Use in combined chest and abdominal surgery. Broad access to thorax and abdomen but have high risk of respiratory complications. Thanks for watching. Hope you understand.